Did you know that the words sports medicine, sports physician, sports specialty don't always mean the same thing? Oftentimes, I see these being advertised either in clinic postings or social media or other forms of advertisement where the physician is saying that they are sports medicine physicians, but they don't actually have a background or a proper education, a curriculum, a traditional education in sports medicine. One of the reasons I like sports medicine, one of the reasons this is one of my first specialties, sports medicine, is because it allows me to get to the root of the problem quickly, come up with an accurate diagnosis, formulate an accurate science-based treatment plan for the patient, track their progress, and make sure that they get better as quickly as possible. And that helps everyone, not just an athlete. That helps moms and dads and grandmas, grandma to be able to lift their grandkid up off the floor or chase after them if they need to. In this next video, I'm going to explain what a curriculum in sports medicine looks like, the additional trainings and the advantages to the patient. Whether they're an athlete or even a non-athlete, there is a competitive edge to receiving true sports medicine care. It can help you get better faster. Sports medicine, sports chiropractic, sports physician are not synonymous. They don't necessarily mean the same thing. In chiropractic, just like in any other medical field, there are specialties. Specific to chiropractic sports medicine, the first part of that specialty is board certification. The process to become board certified is a little over a year. There is classroom work, there is online work, there is a written practical to become board certified. Currently in the United States, there's less than 2,000 board certified chiropractic sports physicians. If the physician wants to take their education past that point, there's a diplomate program. The diplomate is an additional, an accumulated 3-year program. Within that program, there is additional hands-on, there is additional in-classroom, online, and book work. There is a practical component to this education, usually performed on-site at athletic events. There is a written portion to this curriculum that includes having a peer-reviewed, published paper, an additional written exam, and a practical exam. There are currently in the United States, as of 2026, 307 diplomates in America. So what does this additional coursework entail? Emergency medicine is a big portion of this. Oftentimes, if we're the providers at a sport event, we need to be able to take care of emergency situations. We have additional training in head trauma, mild traumatic brain injury, and concussion, not only in the diagnosis and treatment, but also in the return to play. There are some very specific guidelines that should be followed when we're assessing, treating, and returning an athlete back to play. And oftentimes I see this missing, unfortunately, especially in adolescent athletes. We have additional training in biomechanics. That's the assessment of movement and how the body loads and shifts the demands of exercise. We have additional training in exercise science, sports psychology. We have additional training in the assessments, neurological and orthopedic assessments. This is not only through the spine and head, this includes all of the joints. So shoulders, elbows, wrists, hands, hips, knees, feet, and ankles. In addition to the examination and assessments that we learn through this program, we're also exposed to the best practices in current sports medicine, the most advanced treatment and diagnostics. Side note, one of the reasons why I like sports medicine, if I can take a football player who's been tackled and let's say they have a medial meniscal injury, an ACL tear, and an ankle sprain, and I can diagnose this patient, treat this patient, rehab this patient, and get them back to sport quickly, because if they're a professional, their livelihood depends on it. If I can get this human to perform at a high quality after they've been injured, the ability to get somebody who's not performing at that same level to be able to go back to their general life, in my opinion, is much easier. One of the great things about this additional training is, I had a professor, Dr. Buchberger. This professor explained that if we understand the intricacies of how an injury occurs, then we can work backwards and fix it. Oftentimes I have patients come in and they have a shoulder injury and they haven't been properly examined, and the shoulder injury is coming from the neck. We find out it's a radiculopathy, an injury of the nerves that come out of the neck and go into the shoulder. Or I have a patient same thing, has a shoulder injury, and they've been diagnosed with a rotator cuff. But nobody's actually gone in and done a thorough exam. They've just used imaging to make this diagnosis. Upon examination, we find out that their labrum has been affected, so their shoulder, in essence, is unstable. The ability to dive deeper into a patient's condition allows us, again, to come up with an accurate diagnosis, and this allows us to guide treatment properly and get the athlete or the patient better faster than most other places. In addition to the extra work in biomechanics and exercise science and exercise nutrition and athletic psychology, in addition to the emergency medicine and the head trauma, mild traumatic brain injury, concussion, we also get additional training in examination and imaging. And so oftentimes when a patient is not responding properly, it's because the physician either didn't look at the imaging or only used imaging to come up with their diagnosis. This is important in musculoskeletal injury, physical injury. This also applies to internal medicine and functional medicine when we're looking at labs and really applying it to the person sitting in front of us. So I go back to being able to differentiate between like a hamstring tear and like a lumbar radiculopathy. Some of those things might come up on imaging, some of them may not. The ability to look at the patient in front of us and be able to make an accurate diagnosis is going to determine the success of your recovery. What does a typical sports medicine visit entail? A thorough history, vitals, an examination, neurological orthopedic testing, a functional evaluation, assessment, and then a report of findings where you get to learn about your condition. This is also when the physician should tell you what to expect from care, how long that process should take, when care goes from passive, meaning you're going to the office and getting treatment, to active, meaning you're learning how to take care of your body. Whether a condition is acute or chronic, there should always be a plan. In the acute phase, the goal for care should be to assess what the problem is, name the problem, i.e. a diagnosis, formulate a treatment plan, and treat, with the end game of resolving the acute issue, if that's possible. In a chronic scenario, similar, we need to assess the issue, we need to put a name on the issue, the diagnosis, and formulate a game plan again. With a chronic condition, sometimes there requires some additional care. That should always be at the least frequency needed for the patient to be able to live their life to the fullest potential that they want to be able to express. Anytime you're working with a physician, you should always have an understanding of where that end game is, what the end goal is. So what is it that you can look for when you need sports medicine or when you're interested in pursuing this type of work? Ask your physician what additional trainings they have, board certifications or diplomates or fellowships. You can ask them what their typical exam and treatment plan looks like, how they base their decisions and how they track their recovery, how they track your recovery, and of course, an outline of overall care from beginning to end. What does that look like? If you've not heard this type of clinical breakdown, please go ahead and subscribe, drop a line or a comment in our comment section. I check those and respond to those as I can. Book a consult, those are free.